Hello, everyone. Welcome to another special webinar for from LUMP. This time, we shall talk about diaphoresis or excessive or abnormal sweating. Okay. So in clinical setting, diaphoresis is profuse sweating that is not related to the usual and normal stimuli. What this means actually is, even if it's not hot, or even if the environment is not too hot, there will be sweating. That's what we call diaphoresis. So you sweat profusely, and there is no relation to whatever stimuli are present. Okay, spontaneous sweating is you just sweat without any cause. It occurs while you are awake. And again, this is not affected or influenced by environmental factors or physical activity. In other words, even if you're not doing anything, you will sweat. Okay, and it occurs while you are awake. So that's what we call spontaneous sweating. Night sweating, of course, if spontaneous sweating occurs while you're awake, the night sweating will occur while you are asleep. And the night sweating will stop upon waking. Okay, so I hope you know the difference between spontaneous sweating and night sweating. Next. So these are the patterns that, or the etiology and pathology behind diaphoresis or abnormal sweating. Okay, I would prefer to call it abnormal because you sweat even without the stimuli. No? Okay, so we have first the very, very popular lung qi deficiency. This is quite common. In fact, aside from the sweaty hands, you will have to observe how he talks, no? How the patient talks. And of course, when you talk about qi deficiency, you will expect impairment in function, particularly in the lung, like shortness of breath, no? Okay. This harmony between nutritive and defensive qi. So I believe by this time you are already familiar with the four levels, no? Um, the way, the qi, and then we have the nutritive level,
Yin.
defensive level. And at the same time, of course, we have the corresponding qi, no? And we all know that nutritive qi and defensive qi are actually uh, ano ba to? These are actually part of your upright chi, diba? Nutritive chi is the one that travels with the blood. Defensive chi is the one that's found between the skin and muscles, okay? Next is heart blood deficiency or insufficiency of heart blood, okay? So we will try to understand why this happens for people, why sweating or spontaneous sweating occurs in people with heart blood deficiency. Another uh, pattern is blazing fire due to yin deficiency. So I think the two are just basically related, diba? So it's like this is this is a worst case scenario of the previous pattern that we have discussed. Do you agree? No. So you have what we call the empty heat or deficiency heat. That means it resulted from yin deficiency. And then if the empty heat is not resolved, it will it will lead to blazing fire. Okay. Then the last one is heat evaporating fluids. Okay, let's talk about lung qi deficiency. So for a review, the lung, we all know that the lung governs the skin and hair. So this is body hair, the hair of your body, the throughout the body. I don't think it includes the scalp hair. So the first thing that you should really observe would be the skin of the patient, no? And the hair. And a, a patient with lung deficiency will have a peculiar complexion. Okay. Lung controls the defensive chi. And we all know that the defensive chi has something to do with the closing and opening of the pores. Yes? Hmm. Okay.
Yeah.
So when lung chi is deficient, expect the defensive chi to be deficient or weak as well. Okay? When this happens, um, the pores remain open. So there will be the loosening of interstices of the skin and muscles. And so there will be spontaneous.
Question.
Yes, please.
Possible that the defensive chi is strong, but the lung chi is weak. Kasi
No.
like, kunwari, mahina, a weak pulse yung sa lung area.
Uh,
Pero never, like, hindi nagkakasakit. Is it possible?
um, pwede ka magkasakit but not
Not,
related. Yeah.
uh,
And it is already a given that it's the lungs that control the the superficial part of the body, di ba? Oh. So, Wei Qi or defensive Qi in turn controls the opening and closing of the pores. So,
yes.
if the pores remain open because the interstices of the skin and muscles are open, so there will be sweating. Okay, so when
Mm.
you talk about strength of the defensive chi,
Mm-hmm.
talking about its ability to close the pores. Okay,
Okay. Okay.
because as much as possible, we don't want uh, to open the pores, right?
Yeah.
When you
Yes.
open the pores, you're actually making yourself vulnerable to
Pathological.
yeah,
So,
pathogenic factors. Thank you for the question. Do you have more questions? Oy, don't be shy na ha. I want this to be
okay.
we need to understand. Thank you
Okay.
so much, Fritz. I hope that
Definitely.
answered your question.
Yes, thank you.
And okay, let's continue. Interrupt me, okay, so we are on the first pattern, no? So what are the most common causes of lung qi deficiency? To put it differently, what causes a weak lung qi? No? What brings about a weak lung qi? Okay, so here we have chronically weak constitution. You were probably lucky to be born with very weak immune system, with very weak, diba? Like it's so easy for you to tell someone who is so fragile, right? And lung is metal, and metal has something to do with sensitivity. Okay, diba? When you hold a metal, it's like it's supposed to be cold, diba?
Oh, yes.
Metallic, and
Yes.
metal people are good at leadership together with the I don't know wood. But anyway, that's another story. And those people who remain weak after they get sick. Okay,
Mm.
so it is very important that appropriate treatment is given, the right points are administered, no, so
Mhm.
that when one um, recovers from illness, you don't stay weak. I'm sure you're familiar with, you've seen people, they still look weak after they have recovered. What was that? Diba?
What's
Oh,
that?
si Ma'am Elvira. Ano kaya yung kakatakot?
That
Oh, protracted cough. Okay. When you say protracted cough, like it's something that is not the protracted, when you say protracted, it's not like uh It's a very weak cough. Ma'am Elvira, kindly mute your mic. Okay. And also dyspnea. Um, protracted cough and dyspnea, they consume lung qi. No? You know what is dyspnea? It's difficulty breathing, shortness of breath. Okay. Yeah. So when you have difficulty breathing, this consumes the lung qi. Okay. So in my experience, I have observed that when you walk a lot, because I love where I live now. There's the dagat there, and I think most of us have forgotten to really breathe, right?
Yes.
Inhalation and exhalation. And when you walk, the spleen and the lungs, they have a common polarity, right? They're called greater yin, tai yin. And
Mm.
so when you walk, especially if you notice when your spleen area of the leg is tonified by walking, no?
Mm.
You will notice that the lung improves. And I have to admit that there are times when you don't feel like walking at all because of the weather.
Yes.
And so that if you observe closely, your leg muscles are also very flabby. So when they're flabby, I'm not so sure, but I think it makes sense. The spleen area, no? You know where the spleen area is. It will
Mhm.
also lead to a weakening of the lung. And with the lung, you cannot expel phlegm um, well, no? And you form a
Yes.
lot of phlegm. So I hope that makes sense. So let's go to the second pattern. So second pattern is this harmony between the nutritive and defensive chi. Okay. So when there is imbalance, that's why as much as possible, we need to maintain the balance between the yin and yang. Okay, because even when the pathogenic factor like the wind is weak, no, is mild. Okay, like nahanginan ka lang, like and then you happen to have a very uh, big disparity between the yin and yang. Okay, it will lead to disharmony between the nutritive chi and defensive chi. Okay, so the
Mm.
bottom line here is, as much as possible, you have to make sure that you are in tip-top shape. Yun lang yun. And so when there is this harmony, when there is disconnect between the nutritive and defensive chi, and we all know that nutritive chi is the one that uh, that moves with the blood, right? While the defensive
Mhm.
chi is the one more superficial. Um, it's called the Wei Chi between the skin and muscles. So the
The
difference,
cold.
yes, the Koli. I don't know if I pronounce it right. The,
Um.
yes, the defensive Chi will be unable to protect the exterior. Okay, so you will have spontaneous sweating. Make
Mm.
sense?
Yes.
So, okay.
Okay.
Number three, insufficiency of heart blood or heart blood deficiency. Okay. Sweat is fluid of the heart.
Mhm.
Um, that's why when you sweat too, you have to be very careful. Some people, they love to sweat profuse. They love to really sweat a lot, no? You may have heard of personalities, celebrities who had a heart attack even if they are in tip-top shape because they would stay in the gym siguro like 2, 3 hours, no? So when the fluid of the heart uh, becomes so kulang, so it actually becomes so concentrated, and this will impact the heart. Okay, excessive brooding, like thinking too much, no? this can affect the heart and spleen, or even significant blood loss. You see, because when you think too much, you actually what's this? You actually eliminate the chi, become weak. Do you agree? So when the chi is deficient, blood is also deficient. And
Mm-hmm.
remember that the spleen and the heart are like mother and son. The heart is the mother. Okay.
Yes.
So when you think too much, you get to deplete the chi. So blood is also depleted. So the depleted blood is unable to nourish the heart. And when that happens, there will be excessive discharge of heart fluid. Okay. And
Okay.
there will be spontaneous sweating. So it's automatic. I think it's a compensatory mechanism. Okay. There will be excessive discharge of heart fluid, which is the sweat. Because it's kulang eh. No? Because it's kulang. Yeah. Makes any questions? I hope everybody understands that. Okay. Now, let's
Mm-hmm.
go to the fourth one. Blazing fire due to yin deficiency. Excessive strain, blood loss. Um, of course, with blood loss, it starts as blood deficiency, then yin deficiency. Excessive consumption of essence. No? What makes you consume a lot of essence when you are already when you still do things um, that that you can still do 30 years ago. Okay. You forgot that you also age. Okay, so when you do things um, too much, it actually depletes, consumes the essence. Or when there is strong exogenous heat, this will injure the yin. So when the yin is injured, there will be yin deficiency. And when there's yin deficiency, there will be endogenous fire. That means fire coming from within. Okay? So this is not the fire coming from outside. So this endogenous fire will force the yin fluids. Sisipain niya yung yin fluids outward. So this will manifest as spontaneous or night sweat. So in this case, when you have blaze, I think primarily it should manifest as night sweat. So that means you sweat while you're sleeping and also when you are awake. No, that's spontaneous sweating. The fifth one is heat evaporating fluids. Now, it may be uh, important for you to know that when you have pent up emotions, what do you mean by pent up emotions? Emotions that you do not, you suppress,
Mm-hmm.
emotions that you just keep to yourself. If I'm not mistaken, there are places in Manila, I think in Tagaytay ba yun? Yeah, in QC. Yeah. Um, if you are really stressed, you pay for the expensive plates that you want to break, no? But if you have
Uh, I heard about
basagin mo.
that. Yes.
So if you keep the emotions to yourself, because because that's not a good thing. Okay. Ay, wow. Doc Tamayo. Ah, hello po.
Hi, Doc!
Wow, it's an honor to see you. Grabe.
Yes, Doc.
Sige,
Nice to
allow
see
you to
you.
talk about the ano ha, your ano to, your microbiome. Ay, ano,
Yung tibicus, Doc. Oh, why not?
sige,
Why
mamaya,
not, Doc?
mamaya. Sige, I know you love to talk about it. Sige.
Yes,
Yeah.
yes.
Thank you so much for coming. It is,
Yes, of course, Doc.
I miss you na.
I miss you na too.
Okay, magsaringan pa tayo dito. Okay, thank you po. Okay, let's continue. Okay, it is not good to actually suppress your emotions. You have to let them out, no? Because when you suppress your emotions, there will be stagnation of the liver chi. or gelling of the liver qi. And we all know that the liver qi is supposed to be free flowing, di ba? Oo. So when there is qi stagnation, unresolved, then you will have fire. So it's just correct to say that emotions can lead to fire. Okay. Another factor here is like overindulgence in acrid, spicy, strong flavored foods. No? Ay, kaya pala. Okay. I have a friend kasi. He would always eat like raw, ano ba to? Capsaicin. Yung ano, yung red, yung mga chili. Oo. Grabe. And when I look at
I love
it's very huge. Okay. Okay. There will be dampness. There will be turbid dampness, and this can transform into heat. And so there will be liver fire or dampness. Heat becomes strong in the interior, and they will evaporate fluid. So they disperse as sweat. Ay, kaya pala, like, medyo iba yung amoy. Oo. So, yeah, now we know. Umaamoy siya. Oo. Okay. Now we understand why, di ba? I'm not going to comment because I think uh, yung mga tao who are who are famous for uh, being in love with this kind of food happen to be number one sa aking mga so baka alisan lahat. Sige, tagalogin ko na lang. Now let's go to clinical manifestation. So again, you'll have sweating, which is not related to environmental factors. So that means even if it is not hot, you sweat. Okay? And the sweating can be limited to the head and face, chest and abdomen, or the limbs, or generalized. So when you say generalized, entire body. Okay, how many can relate to this? Parang ako yata generalized. Okay. So, spontaneous sweating occurs irrespective of the time of day or the level of physical activity. So remember, spontaneous sweating occurs while you are awake. So it doesn't matter what time of the day or what level of physical activity you get into. And it occurs and this is aggravated by physical exertion. Okay? And you will also have cold aversion to cold. You don't like cold. Lassitude and weakness. Okay. There will be night sweat during sleep, and the sweating will stop upon waking up. There will be recurrent fever and flushed cheeks. So this is the classic manifestation of yin deficiency, remember. And this one is a little bit concerning. How many can relate here? If you notice that your clothes are stained, no, so that means this doesn't happen to everyone. So the sweat can be yellow in color. It's what we call yellow sweat. And you have stickiness and bitterness in the mouth. When you look at the tongue coating, it's yellow and greasy and slippery. Pulse. The pulse is slippery. I'm sorry. Yeah, so we all know that. Very dampness. Sweat will leave stickiness on the skin. When diaphoresis is protracted, there will be lassitude, anorexia, lumbar aches, and weakness. And it is possible that the patient can exhibit both spontaneous sweating and night sweat. So what are the key points of diagnosis? Spontaneous sweating, deficient qi is leaking outward. Night sweat, we all know that it is deficiency heat. No? Diaphoresis due to liver fire or dampness, heat consuming or evaporating fluids is an excess pattern. We know that. Protracted spontaneous sweating may injure yin. Protracted night sweat may injure the yang. So there will be deficiency of both qi and yin or of both yin and yang. Okay. Heat evil will evaporate the fluids over a long period of time, and this can injure the yin. So of course, when the yin is injured, you will have a deficiency condition. So this is an example of an excess condition that has transformed into so it's a combination rather. no? It's present, deficiency and excess. Actually, this is very common sa clinics, no? Shortness of breath, weakness, wind aversion, plus diaphoresis. This is lung qi deficiency. And the pores are open or loosening of the interstices. When you have heart palpitations, insomnia, lusterless complexion, no? You've seen the complexion of those people with heart blood deficiency, right? So you can easily tell talaga. Then when you check their pulse, it's red-like because there's just little blood, diba? So leakage of heart fluid. So the heart fluid will leak out if you have insufficient heart blood. Okay. Cold intolerance, cold limbs, watery feces, white and smooth tongue coating, deep. Okay, I think you all know this. Plus diaphoresis, there will be deficiency of yang qi and weakened yang, unable to restrain the yin. Dry mouth and throat, red tongue with scanty coating. So this is very yin deficiency with empty heat and blazing fire, no? Rapid pulse diaphoresis. And then, of course, the yellow sweat. So at least your sweat is yellow. But the problem here is it stains your clothes. It leaves stickiness on the skin. So there is accumulation of heat evil in the interior and evaporation of body fluids. Okay? Now let's go to the most important part. This is the last slide. So you can take a snapshot. So it's so easy lang talaga to treat, no? The general points are Li4, Si3, and kidney 7. Okay. Li4, it's like we use it to remove the heat, the pathogenic, remove the wind, no? Eliminate the wind. Si3, okay, and kidney 7. Kidney 7 is the tonification point of the kidney, okay? So we use both reducing and reinforcing methods. Okay, apply sedation or reducing on Li4 first, and then you tonify the kidney 7. Yeah. So I think you can use both Li4 and Si3. Okay. Okay, so Li4, Si3, and kidney 7 should be done on all patterns. So if you are sure about the pattern, aside from Li4, Si3, and kidney 7, you will have to add lung 9 and stomach 36. Lung 9 is actually the tonification point of the lung. No? Remember? And stomach 36 is, of course, our source for the qi blood. And if you have a pattern that is characterized by this harmony between the nutritive and defensive qi, aside from Li4, Si3, and kidney 7, you add lung 7. Okay, so next is when you have a patient who has insufficiency of heart blood. Another thing that you have to ask would be insomnia, diba? Or it takes time for them to get to sleep. Okay, so you have to add bladder 15. We all know that bladder 15 is the back shoe of the heart, diba? Kidney 10 is the pussy point of the kidney, and the spleen 6 is San Yin Jiao, diba? It's for the yin of 3 organs: the kidney, the liver, and the spleen. Make sense? So here you could really see the relationship between the kidney and the heart. And since this is every deficiency pattern is chronic, okay? So that's why we need to use the back shoe point. Okay. And okay. For blazing fire Indian deficiency, we add kidney 10 and kidney 6. Kidney 6 is actually my favorite for tonifying the yin of the kidney. Okay, kidney 6 and kidney 3. But okay, again, the main points are Li4, Si3, and kidney 7. And Depending on the pattern, you have to add the points. Any questions? Thank you so much for your attention.
Thank you, Doc.
Thank you. No questions talaga? Okay, Doc She. Oh, dyan na si Madam Elvira. Nasa Cebu na kayo, Madam. Can you please unmute?
Nakamute po kayo, Ma'am Elvira.
Yan na po. Midnight trip me.
Sige, see you tomorrow po. Any question? So now, naintindihan nyo na kung bakit tayo nagpapawis, no? So, baka nahiya kayo because this is recorded, so I'm going to stop the recording. Thank you so much for listening.